Hey everybody, it's Dr. Magnifico from jaredsfulvet.com. I'm at my house relaxing after a long work week. Every week I go to the Humane Society, the Harford County Humane Society, and every week I hear and see cases that really remind me how much work we have to do and how far we have yet to go and how many people need help. So I think it's a really important thing for every veterinarian in every community to go to their local shelter and talk to the staff and hear the stories and walk through the cages and see what's going on. You know, we live in sometimes our own little clinic bubble, and sometimes it's not a really accurate representation of the rest of our community. So a little note to all my fellow veterinarians, please keep a close ear to the ground and understand what's going on in the rescues and in the shelters in your community, and understand how you impact it and how you might be able to help. This week was no exception. One of the cases that really struck me was a dog that was being brought in. He was surrendered. He's a young, healthy, beautiful dog. He was carrying one leg, so he had one leg that obviously had some trauma and some damage to it. And his story was this. He had been hit by a car, so there's a whole bunch of things about being hit by a car that we should talk about. One of them is just how awful it can be and how dangerous it can be and how expensive it can be. I also think it's really important to mention that a lot of the hit by car dogs that I see are young, intact male dogs. They just have a different agenda than the reason that you got them for a pet. So it's really important to do lots of socialization, lots of early training, and spay and neuter your pets. They are far less likely to wander and get in trouble. Anyway, he was hit by a car. He was brought to the ER. He stayed at the ER for a couple of days, and then because he was still lame on his leg, he was transferred to one of the local specialty clinics. At the specialty clinic, he was given an estimate of $3,500 to $4,500 to fix his leg, which they couldn't afford. So they brought him to the shelter and they surrendered him. He's 2 weeks after it's been weeks after his being hit by a car. He's happy, he's active, he's not using that leg. He's never going to use that leg. And I think what struck me the hardest was that these people had spent more than $1,000 in all of the care that he had gotten so far, and they still had a dog that wasn't fixable in their eyes. I don't know all of the details of the story, and I don't want to make any judgments or cast any misappropriate assumptions, but I wish somebody at some point had intervened and said from the very beginning, just get him through the night at the ER, make sure everything's intact, get him home, put him on cage rest, put him in a splint, put him in something that's affordable to give that leg a chance. And then if it doesn't heal and it doesn't work, take the leg off. There are lots of three-legged dogs walking around in the world, very happy, very comfortable, and it's certainly very feasible. But the idea that someone would drop a dog off at the shelter who needs another $1,000 worth of stuff, even if we just amputate the leg, is really difficult for me to understand. There are a lot of really healthy dogs at the shelter, and then there's this poor guy who, now is being exposed to disease. We have to worry about him staying socialized and not getting cage aggressive. And on top of that, he's got an injury that's probably never going to get fixed there. So I think that there are a lot of important points to remember. If something happens to your dog, it's really important for every single veterinarian that you meet along the way to talk to you about all the scenarios. What's the ideal scenario? How much does that cost? If that's not feasible for you, please tell them immediately. Please stand up and please tell them, this is not feasible for me. What's my next option? Go through that next option. Go through the costs, go through the advantages, the disadvantages, and then go through worst case scenario at every single discussion. Every single discussion that you have with your veterinarian should include, what am I going to do if I can't afford this? What am I going to do if it doesn't go well? What am I going to do? How's my dog going to function? Because the most important thing is that your dog, one, stay alive and stay healthy, and two, stay with you. Going into the shelter system really is not the ideal place for any dog to be, especially a dog with an injury, especially a dog who's got a lot of special needs, and especially a dog who's looking at a really expensive price tag to get treated. I make these videos as an educational thing for people so that other people learn from other people's experiences in the hopes that it will help somebody and their dog along the way. But the real drive home point is, Don't walk out of any veterinarian's office without understanding what your costs might be, what your options are, and how you can keep your pet with you and keep your pet alive. It is perfectly acceptable to get some pain management, put that dog in a cage, and rest that dog for 4 to 6 to 8 weeks to see if it will heal. If it doesn't heal, talk about amputating the leg. You can get a leg amputated at a general practitioner's office, in my opinion, for less than $1,000, especially if we're talking about doing it at the elbow or doing it at the ankle, or even at the knee. It really can be done pretty quickly, pretty easily, and pretty affordably. And now we live in an age of prosthetics, so there's even the chance of 3D printers helping make a limb for them. If you have any questions about this or anything else pertaining to pets, you can find me at Jarrettsville Vet in Harford County, Maryland, or you can find me at Pabli.com. Pabli.com is a free open online pet community dedicated to helping pets and their people so that they can live long, healthy, happy lives together. Please take care of your pets. Spay and neuter them. It will make a big difference in them getting hit by a car. Please talk to your veterinarian before you start down a road of spending money and then find out that you've got no money left to treat your pet. There is nothing worse than that. You spend all of this money to diagnose them, and it exhausts all the resources to treat them, and that is a travesty in my opinion. Please contact me if you have any questions, and I wish you all the best of luck. Happy, healthy lives. Take care. Bye.